Senior Associate here at the Center for the Study of Social Policy in Washington, D.C., and the coordinator of the Alliance for Racial Equity and Child Welfare. On behalf of the Alliance, I'd like to welcome you to this afternoon's webinar focused on improving system responses to Latino children and families. The webinar will get started shortly, but just a few brief and important reminders. First, we recommend all participants dial into the webinar using a landline to improve your sound quality and to avoid any connectivity issues. And if you have any issues with sound quality, please hang up and then dial back in. Sometimes the sound challenges are due solely to a bad connection. Questions for our presenters will be answered at the conclusion of all of the presentations. You can submit questions anytime, however, using the question feature in your GoToWebinar control panel. Also, this webinar is being recorded and will be publicly available after the webinar. The link to the online webinar recording will be shared via email after the webinar and can be found on the Alliance webpage at cssp.org. Finally, after the webinar, you can expect to receive a brief survey. We would appreciate everyone's feedback, both about the webinar and about other topics and questions you'd like to see addressed by the Alliance in the near future. The mission of the Alliance for Racial Equity and Child Welfare is to promote leadership and provide information in support of eliminating racial disparities and improving outcomes for children and families of color who are involved with this nation's child welfare system. One of our primary goals is to help individuals and organizations further understand the nature of and the extent of the racial disparities that we see in outcomes for children and families involved with this nation's child welfare system. And because ultimately we want better outcomes for children and families, we also like to highlight examples of agencies and organizations that are actually making the practice and policy changes that really contribute to those improved outcomes that we're trying to achieve. During today's discussion, we'll be looking specifically at the experiences of Latino children and families and the nature of their involvement with this nation's child welfare system. We're really happy to be joined today by several individuals who've been actively involved in some of this work over a number of years. First, we'll have Alan Detloff, Associate Professor at Jane Addams College of Social Work at the University of Illinois at Chicago. We'll also then have Michelle Johnson Toyama, who's an Associate Professor at the School of Social Welfare at the University of Kansas. We'll have remarks by Sylvia DePorto, who's the Deputy Director at Family and Children Services at the Human Services Agency of San Francisco. We'll then have remarks by Raquel Amezcua, who's an independent child welfare consultant now after serving many years with the Orange County Department of Social Services. And then we'll also hear from Nordama Chirinos, who's a cultural broker in Orange County there in California. We appreciate each of you all joining us today and sharing your work and your experiences with us, and so we look forward to this discussion. We'll begin now with initial remarks by Alan Detloff, and then we'll continue in the same order. Alan?
Thanks, Arande. And thanks to everyone who's on the call today. I'm going to start the session today with just a brief background and overview about Latino children and families in the child welfare system, and then we'll turn it over to the other presenters who will go into greater depth about some of the research and practice issues that are impacting Latino children and families. Next slide. So just as a background about the Latino population in the United States, many of you are probably familiar with this, but as of 2010, the Latino population represented 16.3% of the total U.S. population and is the fastest growing population in the United States. In 2010, that figure represented an increase of 43% since 2000. Among children under 18 in the United States, Latino children represent almost 1/4 of all children in the U.S., 22%. Among all Latinos in the United States, nearly 4% are foreign-born, but when you just look at children, that percentage is much smaller, where only 11% of Latino children are foreign-born. So the large majority of Latino children are born in the United States. But more than half of Latino children, 52%, have at least one foreign-born parent. Next slide. And then concurrent with that growth in the general population in the United States, we've also seen a rise in the number of Latino children who are involved in the child welfare system. Since 1995, the percentage of children confirmed as victims of maltreatment who are Latino has more than doubled from 10% to 21.4% as of 2010. And similarly, the population of Latino children in foster care has more than doubled from 8% in 1990 to 21% in 2010. And as I mentioned, this seems like a dramatic rise in the proportion of Latino children involved in the system, but it has happened concurrently with a very rapid growth in the general population. Next slide. Then in terms of disproportionality of Latino children, much of the conversation about disproportionality and overrepresentation in the child welfare system has largely focused on African American children and to some extent Native American children, because Latinos have historically been slightly underrepresented at the national level, and that haven't been part of that larger conversation about overrepresentation. But there are significant state differences in the representation of Latino children that we'll see in a minute. But as I mentioned, at the national level, Latino children as of 2010 represented 21% of children in foster care compared to 23.1% of children in the general population. So you can see that's slightly underrepresented. But if you look at the state level, Latino children were overrepresented in 6 states and were considerably underrepresented in 17 states, where Latino children were represented at a proportion less than half their percentage in the general population. And next slide, we'll see a chart of how this breaks down by state. So this is a chart that displays disproportionality ratios for Latino children in foster care across all 50 states. And you can see the line in the middle of the slide that says 1.0. That indicates proportional representation. So Latino children are represented in foster care at a proportional rate to their population in the general population. Next slide. And you can see here that these 6 states on the right of your screen are the states where Latino children are overrepresented. 3 of those states, Massachusetts, New Hampshire, and Maine, have pretty high levels of overrepresentation, particularly Maine, where that ratio is 2.0, meaning that Latino children are represented at a rate more than, in foster care, more than twice their proportion of the general population. If this was a similar slide of African American children, you would see all of the states above the 1.0 line. So what this shows is that there's considerable variation by state for Latino children's representation. And next slide. And then you can see here in these states, we have pretty high rates of underrepresentation for Latino children, with the states Hawaii, Illinois, Maryland, Louisiana, very high rates of underrepresentation, where Latino children are represented in foster care at a proportion less than half their percentage in the general population. Next slide. And then I wanted to just briefly show the statistics for the California child welfare system, because many of our presenters that follow me will be focusing on research and practice issues in California. And California is a unique state. You could see here Latinos are the well, they're all shades of blue. Latinos are in the general population 53.8% on the left-hand side of your screen. And then you can see how that number changes at each decision point in the child welfare system. So Latino children are 55.6% of substantiations, and then 50.3% of entries into foster care. And then in fiscal year 2012, they represented 48.1% of all children who were in care in the state. And California is an interesting state to look at, because you can see by those figures, Latino children are slightly underrepresented in foster care in California, but they represent the majority of children in care. So California is an example of a state where disproportionality or overrepresentation may not be the driving issue that impacts policy and practice, In California, Latino children are the majority of children who are involved in the system, and therefore the services and policies should be culturally responsive to them, whether or not there's overrepresentation. Next slide. But California is also unique in that it shows how even at the state level you can have regional variation in terms of over and underrepresentation. So as you saw on the prior slide, Latino children are slightly underrepresented at the state level, but if you look at the counties in California, and California is a county-based system, in one county, Santa Clara County, you'll see that Latino children are significantly overrepresented, where they comprise 64% of children in care, although they represent only 39% of the child population. And then you see the opposite in many other counties where they're significantly underrepresented. Next slide. So I want to just briefly mention this issue because the pattern is on the side of underrepresentation for Latino children in the child welfare system. And although that may be indicative of lower rates of maltreatment, it also may indicate that Latino families in need of intervention are not being properly identified. And that may be related to the proportion of families in which the adults or the parents in the household are either foreign-born or non-citizen. And we know that 81% of young children in immigrant families live with at least one non-citizen parent, and 50% live with an undocumented parent. And there's a growing body of research that shows that undocumented or non-citizen family members, are known to underutilize certain public services because they either believe they're not eligible or because they're concerned about their immigration status. And that may mean that immigrant families or Latino families in which parents are foreign-born may not be accessing many of the agencies that serve as mandated reporters, which may be contributing to their rates of underrepresentation. Next slide. And we also know from some research that was done in California by the Urban Institute that when you look at Latino families or Latino children specifically by generation, even though they may be proportionally represented at the state level, different patterns emerge based on generation. This study was done by the Urban Institute in the Texas child welfare system, which is similar to California in that Latino children are slightly underrepresented at the state level. Latino children are about 35% of children in the state and about 33% of children in care. But you could see here when they break down Latino children by generation, first generation meaning foreign-born Latino children, second generation meaning U.S.-born Latino children of foreign-born parents, and then third generation U.S.-born Latino children of U.S.-born parents. You could see that first generation and second generation children were underrepresented in the system, and third generation children were overrepresented. And on the next slide, we'll see the statistics of that. So just to demonstrate that, first-generation children are 7% of the population in Texas, but only 1% of children in care. Second-generation children are 20% of Latino children in the state, but only 8% of children in care. And then third generation, you see that pattern shift, where third-generation children are 22% of children in the general population, but 33% of children in care. Again, when you look at Latino children as a whole, it looks like they're proportionally represented. But when you look at these generations, you see that there's something happening in the third generation where they're overrepresented, and then something different happening in the first generation and second generation where they're underrepresented. Next slide. And then the last thing that we know about Latino children's involvement in the system comes from some analyses of the National Survey of Child and Adolescent Well-Being that many of you are probably familiar with. And from that data set, which is a nationally representative data set of data of children who've come to the attention of the child welfare system, we see that among Latino children, 64% of them have a parent who's born in the U.S., 36% have a parent not born in the U.S., and then consistent with national figures, about 4 out of 5 are U.S.-born citizens. Next slide. And what this research really showed is we were interested in seeing whether there were differences between U.S.-born families and foreign-born families in terms of their the outcomes of their maltreatment investigations as well as risk factors. And this may explain some of the patterns of underrepresentation that we see. On this slide here, you'll see that in terms of substantiated cases, there's virtually no difference between children in foreign-born homes and children in U.S.-born homes. No differences in rates of confirmed maltreatment. Next slide. But when we looked at parent and family risk factors that were available in the INSCA data set, we saw some very interesting patterns emerge. This slide shows you a list of the risk factors that are identified by caseworkers at the conclusion of a maltreatment investigation. And if you flip to the next slide, you'll see that in every instance where there was a significant difference in the presence of that risk factor between U.S.-born homes and foreign-born homes, that risk factor was more likely to be present in U.S.-born homes. So children living with U.S.-born parents were more likely to be living in a home with active drug abuse, a parent with an intellectual or cognitive impairment, poor parenting skills as assessed by the caseworker, a recent history of arrest, or high family stress. All of these risk factors were more likely to be present in U.S.-born homes. Next slide. You'll also see here that INSCA looked at some community factors. These are the community factors that INSCA looked at. And next slide. Again, you'll see in the community factors that could be considered risks, open drug use, unsupervised children, teenagers making a nuisance, those were all more likely to be present in U.S.-born Latino families. And then on the next slide. So just to sum up my portion, data indicate that Latino children are overrepresented in a small number of child welfare systems across the country, about 6 states, but that there can also be even within overrepresentation at the county or regional level. But at the same time, Latinos are considerably underrepresented in many states, which has raised concerns about whether Latino children may be being underreported in certain areas. We also show that there's data that show that differences in risk factors exist, which may explain some of the differences in representation, although we need to do more research about that to identify the source of those differences. And then back related to the point I was making about California, although Latino children are underrepresented in most states, the emphasis on disproportionality and overrepresentation may be overshadowing the need for culturally competent services, particularly in states and jurisdictions where Latino children are the majority of the child welfare population. Those states need to ensure that their services are culturally responsive to Latino children and families. Now I'm going to turn it back over to Arande to introduce our next speaker.
Okay, thank you, Alan. So we've seen some of these patterns kind of emerging over time, and so we really appreciate the background, and hopefully we'll be able to get into some of those trends a little bit more. But it's really, I think it's really important to see both what the trends look like, but then also some of the complexity in there, so we really appreciate that. So now we'll move on to Michelle.
Thank you, Arande.
Thank you.
Thank you, Alan, for the presentation. Good afternoon, everyone, and thank you for joining us today. My name is Michelle Johnson-Moroyama, and I'm an associate professor at the University of Kansas School of Social Welfare. I graduated with my PhD from the University of California, Berkeley 7 years ago, and then served for 4 years on the faculty at UCLA prior to coming to Kansas. So I spent about 10 years in California, and this provided me with some opportunities to collaborate with other California-based researchers and faculty who've really been moving the field of child maltreatment research forward through some exciting methodological advances. And not only are these methodological developments benefiting the field as a whole, they're really helping those of us who are particularly interested in the circumstances of Latino children and families to build knowledge for practice and policy. What I'm going to discuss today are 3 recent studies we've conducted using unique data sets that have been revealing some new insights into risk and protective factors for child maltreatment within the Latino population, specifically in California. In respect of the time we have for today's webinar, I'll spend approximately 5 minutes on each of these studies, touching on their major methodological features and major findings, and briefly discussing their implications. So let's go ahead and get started. Next slide, please. We all recognize that child maltreatment is a social problem, deeply rooted in social, economic, and cultural contexts, and that effective responses require, among other things, an understanding of the root causes of child maltreatment. Next slide. If you could go back one, please. However, despite the growth and diversity of Latino children and families in the U.S. child welfare system, Latinos have historically been studied as a monolithic, pan-ethnic group, with comparison limited primarily to children of other races. This is largely due to the limitations that we're kind of all aware of in terms of child welfare administrative data, or information that might allow us to examine diversity with regard to factors such as child or caregiver birthplace, Hispanic origin, or socioeconomic status are not routinely collected. Next slide, please. The National Studies of Child and Adolescent Well-Being, which Ellen summarized some of the findings from, have been unique and exceptional sources of information about Latino children and families, given the fact that they're population-based and they focus on the U.S. child welfare system as a whole. They're unique in that they've included measures of parent and child nativity, Hispanic origin, and in the latest NSCA study, information about documentation status as well. From this data, as Alan also mentioned, we began to identify systematic differences in risk and protective factors among immigrant children and children of immigrants compared to U.S.-born children and children of U.S.-born caregivers, respectively. As you can see, and as Alan presented, these groups were typically less likely to receive public assistance, less likely to have caregivers with a childhood history of maltreatment, or caregivers engaged in alcohol and drug abuse, domestic violence, and less likely to have caregivers with criminal arrests. They were also less likely to experience substantiated emotional abuse, yet more likely to experience excessive discipline and substantiated physical abuse when we begin to really look at maltreatment type. So some of these findings, particularly those related to risk and protective factors among immigrant families, comported with an epidemiologic trend that has been well established in the public health literature called the Latino health paradox. Next slide, please. As many of you may know, the Latino health paradox refers to a pattern of morbidity and/or mortality for a particular group that is at odds with what would be expected given the group's socioeconomic profile. In the U.S., the health of our populations are typically very closely tied to socioeconomic status, with health status rising and falling with income and education and other markers of socioeconomic status. However, health paradoxes have been observed for adult as well as infant health indicators such as the birth weight and infant mortality in contrast between Latinos when compared to whites of similar socioeconomic status and between immigrant Latinos when compared to U.S.-born Latinos of similar SES. At the same time, researchers conducting longitudinal analyses of data, specifically from the Fragile Families and Child Wellbeing study at Princeton and Columbia, have observed the deterioration of immigrant Latino child health with time in the U.S. and across generations for certain indicators and health conditions. Next slide, please. The Latino health paradox has been attributed widely to protective social and cultural dynamics among Latinos and immigrants in particular, and the social cultural explanation is often presented in association with an acculturation hypothesis that predicts the deterioration of health among Latinos over time and across generations in the U.S., a term that's been referred to as health assimilation. So in the context of these theoretical paradigms, researchers have been particularly interested in understanding how is it in the face of poverty, which is usually such a strong predictor of poor health, how protective social and cultural factors function within the Latino population and how they can be preserved as well as integrated into the design of interventions. I myself have been particularly interested in understanding whether these paradoxical trends that have been observed for infant and adult health indicators also extend to child maltreatment. And if so, what is it that we can learn about risk and protection to promote Latino child and family well-being and prevent child maltreatment? Okay, next slide, please. So now I'll briefly present 3 recent studies that have used some edge methodological approaches in child welfare to address 3 major questions. First, does a health paradox exist in CPS involvement among young Latino children of U.S.-born and foreign-born mothers? Second, does maternal foreign-born status confer some type of protective advantage against reported and substantiated maltreatment? And Is that the case across Hispanic origin groups? And third, does a health paradox exist in self-reported child well-being among Latino children of U.S.-born and foreign-born caregivers? So a lot of the data that we have available has been collected through NSCAW, which was information collected from caregivers. Much of what I'm going to present now depends on CPS records. And the other piece in terms of self-report is what do parents say when they're actually asked by telephone about their children's well-being and their ability to care for their children. Okay, next slide, please. So to address the first question, Emily Putnam-Hornstein, who's an assistant professor at USC and director of the Children's Data Network, she and her colleagues at the California Child Welfare Indicators Project at UC Berkeley linked CPS records to birth records for the full population of children born in California in 2002, and they followed these children until their 5th birthday. Because information regarding maternal nativity and public health insurance status, which here we're considering a measure of SES, is included in the birth record, this study allowed us for the first time to examine whether important differences existed in CPS involvement between young Latino children of immigrants, U.S.-born Latinos, whites, and blacks of similar socioeconomic position. Generalized linear models were used to compute the adjusted relative risk of referral, substantiation, and foster care entry in models that were stratified by SES. And what these relative risks do for us, what they tell us, is they provide a means of comparing the probability of an event between one group relative to a reference group after adjusting or controlling for the effects of other observable risk factors. Okay, next slide, please. What we found was that when compared to whites of low income, which is the comparison group you see here, represented by the red horizontal line, young children of U.S.-born Latino mothers of low income, who you will see in the second column, were at lower risk for all 3 of these child welfare events: referral, substantiation, and foster care placement. And looking at the third column, young children of immigrant Latino mothers were at the lowest risk of all of the groups presented in the figure. While perhaps the most groundbreaking finding of this particular study was actually the lower observed risks for low-income children of black mothers, which you see in the first column, when compared to whites, this study was also very important in documenting paradoxical trends within the Latino population with regard to child maltreatment. Okay, next slide, please. These particular findings led to the second question of whether maternal foreign-born status conferred some type of protective advantage against reported and substantiated maltreatment across Hispanic origin groups. So we see this protective effect in the first study among Latinos when Latinos are treated as a pan-ethnic group. But given the diversity of the Latino population in the U.S. and in California, were there any important differences between Hispanic subgroups? To address this question, we again use CPS records linked to birth records, which contain information regarding nativity and Hispanic origin. However, in order to build a sufficiently large enough sample to examine these relationships, Emily and her colleagues constructed a data set that included data for all Latino infants that were born between the years of 2000 and 2006, and followed these infants through their first birthday to identify those that were referred for child maltreatment. As in the previous study, we used generalized linear models to compute the adjusted relative risk of referral and also of substantiation, and this time we stratified the models by nativity. Okay, next slide, please. You'll see the major findings from this study in the yellow highlighted box. First, we found lower rates of referral per 100 children for all births to foreign-born mothers when compared to U.S.-born mothers. Specifically, in the first column, you'll see an alleged maltreatment rate of 2.7 for all Hispanic births among foreign-born mothers, compared to a rate of 7.2 for U.S.-born mothers, which was statistically significant. We also observed this disparity within every single Hispanic subgroup that you see represented here. And for the first time using this data, we were able to observe disparities between Hispanic subgroups, with lower rates and risks for referral among infants of Mexican and Central mothers when compared to their Puerto Rican counterparts. Next slide, please. We also observed similar trends in this sample for substantiation, with lower substantiation rates among all Hispanic infants of foreign-born mothers when compared to U.S.-born mothers, and disparities within Hispanic subgroups that were similar to those for referral. Using linked data, we also see constellations of risk factors in the birth record for maltreatment that are similar for infants of foreign-born and U.S.-born mothers, but these risks, the estimates tend to vary in terms of their size between groups, suggesting important directions for future research. For example, in this slide, you'll see maternal education of high school or less and a lack of prenatal care associated with much larger estimated risks for substantiation among the U.S.-born sample when compared to the foreign-born sample. The next step in our research is to examine whether unique risks and protective factors exist within Hispanic origin by nativity groups to better inform group-specific prevention efforts. Next slide, please. The final study examines yet another question about the Latino health paradox, but this time from the perspective of caregivers versus that of CPS records. So in 2009, Bridget Freisler, a colleague of mine at UCLA, conducted a population-based telephone survey of caregivers regarding child abuse and neglect in 50 California cities. The survey methodology was really novel in that it allowed participants to use interactive voice response technology to answer questions about their parenting practices with the intention of eliminating the type of social desirability bias that's typically associated with survey responses to sensitive questions. The survey design also allowed participants to provide their responses anonymously and confidentially. Therefore, the need to report what the participants were reporting over the phone was precluded. Using data from the survey, I examined whether health paradox existed in self-reported child well-being among the children of U.S.-born and foreign-born caregivers of similar socioeconomic status by examining participants' reports of past year prevalence of the following parenting behaviors, which were items drawn from the multidimensional neglectful behavior scales. The first one was caregiver ability to provide sufficient food for the child, their ability to take the child to the doctor when he or she was really sick, and their reports of leaving their children in places where the caregiver wasn't sure if that child was really safe. Next slide, please. Comparing the relative odds of each child risk, given caregiver race ethnicity in models that were adjusted for covariates, and again stratified by household income, we can see the challenges that foreign-born Latinos, who are depicted here in green, face in addressing their children's basic needs for food, for medical care, and for safe supervision. These challenges are really amplified when we look at the lower income group that you see situated in the middle three columns of the figure, with household incomes of less than $40,000 per year. Here, immigrant caregivers had nearly 12 times the odds of whites, who are depicted in blue, of inability to provide sufficient food for their children, and nearly 8 times the odds of inability to take their children to the doctor or to feel confident in the safety of the places where they were leaving their children. We see in the higher income group to the right that additional resources do offset some of these risks, but not all of them for foreign-born families. Next slide, please. So through methodological innovations in child maltreatment research, data sharing, and research collaboration, we're now able, perhaps for the first time, to see the ways in which nativity and Hispanic origin shape maltreatment outcomes using sufficiently large population-based samples in California. Our major findings comport with other studies that have observed health advantages among foreign-born Latinos when compared to U.S.-born Latino children, particularly in the areas of low birth weight and infant mortality. The findings are also consistent with studies that have demonstrated poorer infant health among Puerto Ricans when compared to other Hispanic origin groups, and studies that have identified paradoxical relationships among Mexican origin populations, that is, optimal health against the lowest levels of income. Next slide, please. At the same time, some of our findings with regard to CPS involvement are still very preliminary. More research is needed to understand if protective factors and or differential surveillance patterns explain paradoxical trends in CPS involvement, particularly among specific subgroups. For example, as Alan mentioned, we know that in early childhood, immigrant caregivers, particularly those without documentation, are far less likely to come into contact with early childhood care providers, healthcare providers, and providers of social services, who are also typically mandated reporters. Moreover, additional research is needed to examine the unique composition of risk and protective characteristics within Hispanic origin groups by nativity to inform group-specific prevention efforts. However, the challenges that foreign-born caregivers of low income reported in the third study, that is, in meeting their children's basic needs for food, medical care, and safe supervision, are significant, particularly when we consider the fact that on average, our study participants were older, and they were also of higher income than the average Californian based on 2010 census data. The detrimental effects of insufficient food, lack of medical care, and unsafe supervision on the physical, cognitive, and emotional development of children have been well established. Given the rapid growth of this population, it's imperative for policymakers, community-based organizations, and practitioners to work towards solutions to the problems signaled by these findings to address growing disparities in the health and well-being of Latino children. Next slide, please. That's all I have for today. I look forward to hearing your questions and ideas, and I thank you very much for your time today.
Thank you, Michelle. We really appreciate the what I would say is the more nuanced analysis about what the experiences are, but then also kind of painting a picture about what some of the needs are. And, you know, of course, that this is very local, and so what applies in one place may or may not be, may be related to, but may have some level of difference in another place. But we really appreciate that, because ultimately the research is what it paints the picture that we need to understand in order to have the system responses. So it's very much appreciated. So now we will move to Sylvia DePorto there at the Human Services Agency of San Francisco. Sylvia?
Thank you. Thank you to Alan and Michelle for setting the stage for continuing discussion. I'm Sylvia DePorto. I'm currently the Deputy Director for Children's Services here in the County of San Francisco. And I'm going to be talking about the efforts that California has made on a statewide level to address the needs of the Latino population in the child welfare system. Next slide, please. So back in 2012, our state social services director, Will Lightburn, decided to pull together a representative group of child welfare professionals and community-based professionals working with the Latino population. The child welfare professionals represented different counties throughout the state of California. There are 58 counties in California. And we were brought together to discuss what efforts were being made already to address the needs of the Latino population, what were some of the different innovations that we saw, and what was some of the data, and how could we as a state begin to meet the needs of the Latino population in the child welfare system. That was formed in 2012, and in order to accomplish some of those activities, we did surveys that, across the counties. Every county was asked to participate in a survey to identify what specific practices they were doing within their counties to serve the Latino children and the families that were in their counties. We were also focused on identifying whether there were any evidence-based practices being applied, in California or any other states that we could import into California for serving the Latino population. We also wanted to take a look at different models of differential response and do some analysis to see what their impact was on Latino children and families and whether that was something we should be doing statewide, since we have such a large population of Latino children and families in the state of California. We also focused our efforts on collecting policies and procedures used by counties across the state, as well as other states who had policies and procedures for how to work with Latino families and specifically immigrant children and families as well, since that is a different ball of wax, so to speak, for child welfare agencies. And then we wanted to figure out how do we spread this information and the services and the practices and the models that we were using across California, so that even though maybe some counties already had things in place, we wanted to make sure that all of the state of California was able to have a place to access that information, speak with each other, different practices, and be able to implement them as needed for their county. Next slide, please. So some of the practice innovations that we saw throughout California, I'll kind of go through them. I'm not going to spend too much time on each one. And cultural brokers is one that I think you'll hear some more information on from our next two speakers. But cultural brokers basically were community members who were located and asked to assist us in interfacing with the community, with our Latino community, on larger issues around how do we access the community, how do we work with the community, how do we communicate with the community, but also on individual cases. Cultural brokers were folks from the community who were familiar with it, who knew the people, who knew the resources, and would work directly with child welfare to address specific issues, both on a larger scale, systemic issues, as well as individual cases. Promotoras are actually community professionals, usually coming from community-based organizations, and in many agencies being used by government agencies, where they're usually a paraprofessional level position, but community-based folks who speak the language, who know the culture, who can go into the community and provide information around different programs, services, and encourage the utilization of those programs and services to try and address some of the issues that I think both Alan and Michelle talked about, which is some of the fear that our immigrant populations have to come forward when they have difficulties in their families, when they're not able to access resources because they're concerned about immigration issues or legal issues. And so promotoras really are a way to bring the practices to the community, to the families, and make sure that children are getting the health and nutrition and well-being is being addressed in those communities. We're utilizing birth parent mentors in our agencies, especially in child welfare. This is a growing resource for child welfare agencies, where we're using families who have come through our systems and have been successful in reunifying with their children, and we're bringing them in as partners to really work with us on partnering new families who are coming through the process and who need somebody who understands from their perspective and can communicate with them regarding the parent's perspective. It's been a very effective resource. Differential response is something we've looked at statewide. It really is just us looking at what cases does child welfare really need to be interfacing with, using a risk and safety tool to really assess the risk level of cases, and those that are low to moderate risk being referred out to community providers. And in developing differential response, it's very important that we are able to develop programs that are both culturally and linguistically appropriate to serve the needs of the community. These are families where we don't need to bring them into the child welfare system, but we can refer them to services and where they can feel safe and receive services in their language and that are culturally responsive. Family finding is an important part of child welfare as well. When we have families that come into our system, our requirement is to look for families and do relative searches to the 5th degree. These relative searches are really done for many reasons, and for placement options, for permanency possibilities in the future if a family doesn't reunify, a lot for family support. How do we make sure that our families have the support that they need to help them through a child welfare intervention, as well as help them once they leave our system? We want to be able to make those connections and sometimes even rebuild relationships that have been hurt and damaged as a result of some of the difficulties that families have gotten themselves into. And for our older youth, really making sure that we're able to find families or people who have been important in their lives, like in the Latino community, connecting back with godparents and making sure that there are lifelong connections for the youth who transition out of our system when they haven't been able to return home. Safety organized practice is one of our newest practices that we're implementing in child welfare, and it's very culturally relevant in that it really is a practice that uses tools that allow us to work directly with the family and get the family's input and their perspective on what it is that's going on with their family. There are tools that one uses both with children and with adults that are focused on three main areas. One is collecting what are the worries of the family, what are the things they worry about, what is causing difficulties in their family, both in the past and in the present, and then what is working well in the family, and when they have things that are going well, what does that look like? When they have challenges, how do they resolve them? And really getting their input on how that works when things are going well. And then their wishes. If things were really doing, if their family was really doing well, what would that look like? Really doing a safety mapping with the family to develop a map, so to say, of how to keep the family safe, a roadmap about who will do what, when they will do that, and how that will be followed up. Family group decision making really is a tool that really honors families, and I think is very culturally relevant in that it allows family voice and choice to be the main focus of those meetings. In most family group decision making, the professionals, once the discussion occurs, the professionals leave the room and the family is allowed family time to make the decisions about what's best for their family. And that is a very culturally appropriate tool. Family to family is something that we have done in the state of California for a number of years, and that really is also focused on getting family voice. One of the tools for family to family is team decision making, which is really focused on placement. And team decision making meetings are usually called at the beginning of an intervention. If we are concerned that we need to remove a child from a family, we have a team decision making meeting to hear the family's voice about what their concerns are, to really let the family bring folks in that can be a support and that can possibly provide an alternative to our formal intervention while they work out difficulties. So there are a lot of options available to the family when pursuing team decision making. Also, it's a way for us to manage reunification. So when children are getting ready to return home, we want to be able to transition them home well and to be able to provide the family with the support that they need. So a team decision-making meeting would be used for that as well, and that's part of family to family. Some of the other core components of family to family are really resource families and making sure that we're recruiting families that meet the needs of the children we're bringing into care. And so that would mean that we needed to go do targeted recruitment for Latino families. And then developing our community providers and our community supports around those families. Next slide, please. In many counties in California, what we saw were specialized units or positions for, I would call them Latino specialists, for lack of a better word, where we would have a number of counties who had units that were filled with staff who were both culturally and linguistically sensitive to the Latino population and would work specifically with those families. So caseloads may have been monitored differently for them in order to make sure that our bilingual families or monolingual families went to the specialized units. We also had specialized positions that worked specifically with our local consulate offices. So in many counties, we have liaisons who work between the Mexican consulate's office and our agencies to really facilitate relationships with family in Mexico, to facilitate possible placement and services with families in Mexico. In San Francisco, we have a lot of diversity in our Latino community, so we have a number of relationships with different consulate offices, the Consulate Office of Nicaragua and El Salvador and Guatemala, because we have a number of different Latino groups here in the county of San Francisco. Our workforce development strategies were really focused on recruitment efforts for bilingual staff, looking at caseload differentials for bilingual staff and pay differentials so that we could recruit Latino social workers who were bilingual and bicultural to work with the Latino population. We really worked hard to develop partnerships with our community-based organizations that knew the community, that worked in the community, and that were partners that we could resource, use for resources for our families when we were engaged with them in a child welfare capacity. We developed community and staff advisory groups to address issues. Common issues were a lack of understanding, a lack of cultural responsiveness, a lack of appropriate communication, and so community and staff advisory groups exist in many agencies to address ongoing challenges between the community and the agency. Making sure that we have linguistically responsive services has been one of our focuses in the state of California. When almost 50% of those children coming into care are Spanish speaking, we need to make sure that we have services for them, as well as we need to make sure that we have placement resources for them that are culturally responsive and that also speak the language of the children. So specialized recruitment, where we were focused on just really Spanish-speaking parents and making sure that we had the resources available. Where this is sometimes a challenge is that we have many Latino families that come to us that may not speak necessarily Spanish. They may speak a dialect that is very unique, and or they may just need additional resources and services that we don't have. And so really being able to try to find those and work with the consulate's offices and work with the community-based providers to secure those services is imperative. And our lastly, we focused a lot on data collection and being able to really take a look at, identifying, as both Michelle and Alan had outlined, is that the needs of the Latino population is different based on the number of years they've been in the country and other factors, and being able to capture that data and to inform our staff to appropriately capture that data is important, so that we know what the issues are that we're working with and who are the people that we're working with and what their needs are. And I believe that's the end of our LPAC. Thank you.
Okay. All right. Thank you, Sylvia. And we look forward to hearing maybe a little bit more during the question and answer, but we appreciate the detailed description of the work that you are doing and that you've developed over time. So now we'll turn it over to Raquel.
Hi there. How are you doing?
Great. Thank you.
Okay. Well, get started?
Yes, absolutely.
All right. Hi, everybody. This is Raquel Mesqua. I'm actually here at one of our major community partners places in the middle of the city of Santa Ana called Latino Health Access, and I am sitting in Noraime Chirino's office. So you may hear us both talk a little bit. We'll start with the first slide, cultural broker training. I want to let you know that this started way back in 2010 as an idea. We had gone to Fresno. We heard Margaret Jackson speak about cultural brokers in Fresno, California, and also learned that she is listed in the CaliforniaEvidence.com if you want to go there to read about what she did and started as cultural brokers in Fresno. It sounded like such a great idea, we thought we'd try it out here. Little did we know that it was going to take from maybe 2011 to 2013 to build the foundation with our community partners in working with the demographics here in Orange County, California. So it was actually in 2013, and you see on slide here too, that we were able to bring these organizations together for our first test project. And I'll call that test project a PDSA, which stands for Plan, Do, Study, and Act. So the first 2 years was the planning portion. The past about 6-7 months were the testing portion. And in the recent months, last month and this month, we have been doing an analysis of the first phase of the cultural broker and now preparing for the second phase. So what you're going to hear about today is what the training was like for cultural brokers, what our findings were, and then a couple of case examples that Noraima will have for you. So you can see here on this slide we have representation from the Arab American community, access, our court, and those were county council and our presiding judge at that time, the vets, Casey Foundation, Latino Health Access, where I am today, OCAPICA, otherwise known as Orange County Asian Pacific Islanders Community Program, Consulate of Mexico, and then the NAACP. I want to note that other organizations approached us after they saw how cultural brokers were working and the training that they received, and they're interested in now becoming cultural brokers. Let's go to the next slide. Are you trying to get the next slide up? Okay. Here's the overview of what the cultural broker training included. I talked about the Plan, Do, Study, Act. Normally that PDSA lasts for about 30 days, but in the case of Orange County, we needed to extend it for various reasons. The first one being that we started it in August, it ended at the end in December. All the holidays came in there, so much of our staff were gone. Many of the cultural brokers were gone, so we had to restart the PDSA in 2014. The issues or things that we covered in training, we gave them a very detailed training on what is the journey through social services, how do they come to social services through children and family services, what is a child abuse report. They were also required to go as ride-alongs with our emergency response team, just to sit there and go with them before they actually started as cultural brokers to see what was the role of the social worker, how were families responding, what was it that needed to be done. Cultural brokers were also required to attend a minimum of 2 court hearings in the juvenile court system to hear what the court cases were about. At the end of all of the training, they were awarded a certificate. And I have to say that during this training, there were a few community partners who went to court, claimed they were cultural brokers so that they could gain access into the courtrooms. So we quickly had to provide a list along with photographs and copies of certificates that went to the court so they knew who were certified as cultural brokers. We'll go to the next slide. Okay, that looks confusing. There we go. Learning objectives. These are the objectives that we gave to our training, or in our training, what was the value of partnering with the cultural broker. And I'd like to just stop there a second and say that this one was an uphill battle, in that if you know social services, you know that there are lots of laws, lots of policies, lots of regulations. There is a practice and mandated things that social workers need to do. So when we proposed that we would do the cultural broker program, many were concerned that this is one more thing to do and we don't have the time. So in how we did our outreach, it was very important to share with social worker staff, social services staff, that cultural brokers in fact could potentially lessen the workload at the front door, where we get the child abuse reports and we go out with emergency response workers. We did talk about what is the role of the cultural broker, strategies to strengthen the relationship between our community partners, cultural brokers, and the social workers to best serve the family. And then a very, very comprehensive training on our policies, procedures, rules, and the Welfare and Institution Code, especially confidentiality. Go to the next slide. We're in California, so it's taking a little while for it to come out this way. Key points in cultural brokering is to recognize the importance of early partnerships. What we were proposing here as a key point is the critical point of engagement is the first knock at the door. The knock at the door where the emergency response worker is knocking at the door of the family to talk to them about a report that they received. It's at that critical point of contact that when using a broker, it was our hypothesis that a cultural broker would help build the bridge. Another word would be trust between the family and social services, so that we could find ways to make sure safety was stabilized and maintained in the home, with the ultimate goal of decreasing the number of children coming into the system. We can go to the next slide. I talked about confidentiality. It took about 2 years to be able to get permission from our courts to allow community partners to be there at that point of critical engagement, the point of knocking on the door. We needed to find a way, and our county council was very good at that, in finding a way that our community partners who were trained could share in that confidential information with the social services, social workers. And that was through, we'll go to the next slide. And I know you've all heard this term before, so as soon as it comes up, I'll share that with you. Okay, we're missing that one slide I think I forgot. It would be through the multidisciplinary team. And if you look in the Welfare and Institutions Code, you will find that if a community partner is part of that team and has been approved and sharing information at the beginning of the case, in the case of cultural broker with emergency response, that they were allowed to participate at that critical point of engagement. Consequently, our presiding judge in our juvenile court system signed a miscellaneous order that gave permission for certified cultural brokers to participate fully with social services when teaming on emergency response calls. Our slide right now, what is a cultural broker? As you've heard me say, they are like a liaison, a cultural guide, a mediator. I would say catalyst for change, but really what I have learned is that they build that bridge. They build that trust. I think Sylvia said earlier about the promotores, that they are champions in the community. They are people that when we knock at the door, it's likely the family will recognize that cultural broker because they're part of the community. That being the case, that allows the family then to begin an open dialogue between the social worker and the cultural broker. Go to the next slide. The core belief here for the cultural broker is that regardless of race, ethnic background, economic status, that the family can be empowered, that we would want to be strength-based, and that the cultural broker will work with the family to engage them and to identify the strengths and the capabilities that they have so that they can maintain the family unit. The program provides brokering, advocacy, and support to the families who are involved or at risk with the child welfare system. Next slide. Okay, goals of cultural broker. The outcomes that the program hoped for was to increase the cultural prevalence of child welfare practices and approaches to our families so that we could meet their needs, and to decrease the likelihood of cultural misunderstandings between families and child welfare social workers. Next slide. I can see we're running out of time, so I'll try to go faster. Okay, this is to reduce the rates of disproportionality, empower our families, and increase child and family engagement participation with the child protection worker in decision making. These were goals for the cultural broker. Next slide. The essential component, and one that is different from the cultural brokers, if you look up in the California evidence-based information, theirs is different in Fresno. The one in San Diego is different, and I believe there's one in Los Angeles that they're looking to develop. Ours was different because we took the bold step of testing the idea that the best time to use a cultural broker with social services was at the point of critical contact, the first knock at the door. So all this slide really says here is that we were proposing that cultural brokers would go out with the emergency response worker for immediate response cases. Next slide. The role of the cultural brokers ultimately was to show that we could potentially partner with our significant community partners and those such as promotores to help us working with our families. The next slide. The role of the cultural broker, in some cases, families did ask that they attend court with them. They assisted at team decision-making meetings. They also assisted them when there was an identification of something missing in their home or if there was domestic violence, that they needed a restraining order, cultural brokers were the first to say, we will assist you in providing those supports and resources. I'll go to the next slide. Okay, the minimum provider qualifications, I'm not going to go through the whole list here, but you can see that we do require that they attend training, that they are experienced as community representatives like Latino Health Access, that they have a bachelor's level or master's degree or something close to that, such as a paraprofessional here at Latino Health Access. A history of experience in working with different cultural groups, and also a history of experience in working with social services. Next slide. This is important. Cultural brokers are not official language translators, social services employees, spokespersons for an entire culture, child abuse professionals, and again, not employees of social services. It's also significant, we can go to the next slide, it's also significant to share here that cultural brokers for this Plan, Do, Study Act testing period are all volunteers. All of them have full-time jobs, and yet we're finding the time to attend the training and make themselves available to social services, the emergency response team. What you see ahead of you here is a copy of a brochure. There's this slide, and I think the second slide, this is the front, and there's also the back. These brochures were being used by emergency response social workers and the cultural brokers, which has in there the vision and mission statement, what is a cultural broker, their pledge of confidentiality, because they are champions of the community. We wanted our families to know that cultural brokers would not be talking about their cases with anyone. Next slide. Okay. At the end of the training, you can see this is the certificate that they received. In addition, I mentioned that they also have their pictures taken so that those are submitted to court. But you can see that there's actually 8 hours of broker in-class training, child abuse reporting, the observations in court, the observations in the ride-alongs. Very, very quickly, I want to say that our biggest challenge was making sure that cultural brokers could be available for immediate response because they were volunteers. We believe that if they were funded, of course, then they would be available when needed to go out on immediate response cases. I do have to say that social services has worked with the cultural brokers and found them to be in many of the cases that they've gone out to. At this point, I'd like to put Noraima on the line so that she can give you a couple of examples of cases that she went out on. Thank you.
Hi, my name is Noraima Chirinos, and I have been working for Latino Health Access as a promotora for 20 years. And this is a very good and a wonderful experience for me as a promotora to work directly with the social workers and the community. It's because our Latino community is really afraid about social workers. They make a relationship, between the social workers and families. They see social workers are enemies because they took away the child from the family. So it is very interesting to help them in that situations where they are involved with the social workers and law, because they don't know too much about the law in the United States, or they listen or know too much about that word neglect. So one of my experience is that I received a call from a social worker. She received a report for medical neglect. She invited me to visit the family to talk to them. So when I was there, it was also a nurse in a house, and she was explaining to the family about that happened, and she recommends the family to connect with any services to teach them about nutrition and exercise and all the things that help with the overweight. And the child that receive medical observation was one that has already a diagnosis of hypertension. So when I hear that, I connect that family with a resource in Latino Access that is a program that work with obesity prevention in the childhood, and the family attends the 7 sessions. They learn a lot, and they are implementing all the concepts of a new way to practice nutrition in a family. So that helped a lot, and she's working still with the discipline with the kids and many of that thing, but she can remove all the chatarra food in a menu, and that is helping a lot. Also, we give them some resources for find because they have transportation problems. We find for them bus passes, and that helped a lot to the family allowed to come to the classes. In the other way, we have many stories with interesting experiences. But as a cultural broker, I take that opportunity to put or during my work as a promotora in a community, I have one of my work is giving some classes and presentation about mental health, and I include the information that I learned in a cultural broker training about what is neglect, or the things that can involve the family in a crisis problem because neglect. So that concepts are very important for the community, and I implemented in the classes, and I think that's the way that we can educate the community. And the most important is to allow support through cultural brokers to families that are that by their cultural view, in many cases, are not doing nothing, but under the law, they are pushed to a crisis situation unknown for them. Cultural brokers are people from the community that already serve their community, and is people that community can trust. It is easier for families to trust in a broker because they understand our culture and know the resources. And we can do that bridge that Raquel already was talking about, the community, social workers, and resources. So thank you very much.
One last thing that I want to add before we close is that the lesson learned, one of the biggest lessons learned was that we thought cultural broker meant matching Latino services to Latino families. And although that seems obvious, that wasn't the only culture that needed to be addressed. The final culture that we all had to think about, and we're still talking about, government culture, in that we cannot negate that there is a history of distrust between the families and government institutions. So when you get a promotor or a community representative who's a champion, it helps build that bridge between government culture and the cultures that are being represented in the families that are reported to us. Thank you.
Okay. Thank you very much, both of you, for the insight about how the cultural brokers effort is working out there. I think it's very, very valuable, and I think there may be some questions about it as well. We have a few questions that have come in, and I'd encourage anyone who has a question that has not shared it already to share your question using the question feature on the control panel, on the GoToMeeting control panel. So we'll pick up with the first question just in the interest of time, and I am mindful of time, so we may go a few more minutes after the scheduled end time, but we'll at least pick up with this first question now. One of the questions that came in, and I'll direct it, I guess, initially to Sylvia, who it was directed at from the person that posed it, but if others want to weigh in, then please do as well. But the question specifically is about the linguistically responsive services, and just if you could talk a little bit more about how you've been able to develop these over time, and both in terms of quality and in terms of making sure that families get matched with the right kinds of services.
Well, I think linguistically responsive services has been a challenge because there are variations depending on where you're at, and just in terms of how the family identifies also culturally. If, for example, here in San Francisco, we have a population of Mayan people who do speak their Mayan dialect, but they also speak Spanish. And one of the things we found is that the group does not identify Latino, and so they don't necessarily reach out to the Latino community-based services. They really identify Native American, and they've connected with the Native American community for services. And so one of the things we've really worked hard to do as an agency in conjunction with both our Native American Resource Center and our we have an organization called Instituto de la Raza, is to have those two organizations connect together so that they're receiving the services that they need, but the language needs are also being met, because so many of the Native American people, don't speak the language, but our folks at Instituto do. So it just really is, it's about really looking into the community and trying to develop those resources and connect those resources as much as you can. And one of I would say one of the biggest resources for us have been our consulate offices, who in many instances we're reaching out to for language translation, or for looking for family in other countries. And just being able to have that relationship with them is what helps us to be able to access the resources. I think one of the barriers that we continue to struggle with are professionals who can provide some of the services that we need in child welfare in the language of the families that we serve. And that just continues to be an ongoing struggle for us. If it's not, even within the Latino community, if we're talking just Spanish in general, the amount of resources of professionals who can actually do therapy or anger management groups or parenting classes, and on top of that, evidence-based programs in those languages are few and far between, and they're very, very stretched in providing those services. So we're constantly looking at how do we recruit from our local universities, not just to the child welfare organization, but to our community organizations. And that's part of what we do in our community-based partnerships, is really talking about how do we interface with the universities to recruit the staff that we need to do the jobs that we need in the language that we need. So, it's not a perfect system, because I really don't have the answer for being able to create those services.
Mm-hmm, mm-hmm. Okay. All right. Thank you, Sylvia. There are a couple questions that have come in related to the cultural brokers, so I'll frame at least two of these together. So one of the questions is, how do you retain the cultural brokers, and so keep them on board? And then another that was kind of paired with it was, how many cultural brokers have actually been trained, and are any of those indigenous immigrants? And the that went along with it is that there's a rise of indigenous immigrants in California, and there are many challenges that they face in terms of language access as well as cultural differences. And so can you speak a little bit about these dynamics in terms of cultural brokers?
Yes, this is Raquel. I think I can. Let's start with the first one. How do we retain our incredible cultural brokers? Well, I think in the very beginning of my presentation I said they're volunteers. In spite of what our testing period was, and all of you know that emergency response works 7 days a week, 24/7. Our cultural brokers could not, and especially because they had jobs. So we did have to obtain permissions from their executive directors of each of those community organizations and immediate supervisors to allow them to go out when they could with our emergency response workers. That said, our data showed that our cultural brokers were not 100% available to go out. I'm trying to get speech. Can you hear me okay?
We can hear you.
Okay. It started to echo back to me right now. I'm sorry.
Okay.
Interestingly, at one of our meetings, Eliminating Racial Disparity and Disproportionality, which came from Family to Family, by the way, that was referenced earlier, we had a representative present. She'd heard about cultural brokers and is interested in possibly providing some funding so that they can continue with social services. I have to also say, in addition to funding, one of the things that came from community partners, and all of you have experienced this as well, they are completely dedicated to the process and the belief that cultural brokers are necessary. So paid or not paid, they still do what they want. And even though the testing is over, there are still social workers contacting cultural brokers to say, can you help me? And because they've been certified, they've been allowed to do that. The other question was how many? I believe, I'm just thinking off the top of my head, there were 6 organizations, and a minimum of 2 cultural brokers from each of those organizations were trained. So we had roughly 12 to 14 cultural brokers certified and trained. And then there was a third question. I think you said about indigent immigrants. And yes, the answer is yes. Some of the cultural brokers, specifically Latino Health Access, and the Mexican Consulate have been able to assist and provide cultural brokers for that population.
Okay, thank you. Was there any more? Okay. Okay, thank you. So again, I'm mindful of the time, and so we won't go any more than about 5 more minutes, just be mindful of people's time. I do want to at least get another couple of these questions in, and I guess I'll try to pair these 2 questions as well for both Alan and Michelle, or at least starting with Alan and Michelle. So one question is, in terms of the child welfare trends, in terms of representation in the child welfare system, and then more generally in the research, is family size, and so whether or not the family is a family with a large number of children or a small number of children, is that factored into the research and in any way in looking at the over and underrepresentation trends? And I'll couple with that another question that came in any of the data collection that's been done so far, is there any distinction being made between families who consider themselves to be white Latinos or otherwise?
I could start and then turn it over to Michelle, who may have some additional information. I think the issue of family size is accounted for in the way that a disproportionality ratio is calculated, because we're looking at the number of children, number of Latino children in a rural population compared to the number of Latino children in the foster care system. So we're not looking at families or cases. It's not looking at on the case level. It's looking at the individual level. So the issue of family size should be accounted for in that. As far as I know, there hasn't been any research done that's looked at differences in the way Latinos identify. Michelle has done some research by country of origin, but I think what the question is referring to is whether people identify as white and then Latino ethnicity, or black as a race and Latino ethnicity. And I don't think that research has been done. Typically, the way most research is done with Latino families is that the Latino ethnicity is considered the higher level. So if someone identifies as Latino ethnicity, whether they selected a race that was white or black or Native American, they're counted as Latino. But Michelle, do you know anything more?
Yeah, I can tell you that in some of the, well, with the self-reported parenting behaviors I was referring to, in that particular study, we did include both those who reported any race, but also included Hispanic ethnicity or Latino self-identification. So, what you're saying, Alan, is right. With most of the studies, we focused more on the Latino identification versus the racial identification, which does have implications, kind of for those like the Mayan population who may not necessarily identify as being Latino, but may identify as being Native American. It could be that in some cases we may have an undercount, in some areas for populations, depending on the data that we're using and how those questions are asked, whether they're asked in a hospital setting, what the actual questions are that are being asked with regard to race and ethnicity.
I think we're learning in a general sense that there's a potential with this population to have some just data collection problems that may lead to underreporting of Latinos' involvement in the system, because it really depends how caseworkers are gathering that information. Ideally, caseworkers are asking families to identify rather than making assumptions about their Latino ethnicity, which could be done sometimes by just looking at a person, or sometimes it could be done by their last name. So I think through a lot of this research, we recognize that there needs to be better training in child welfare systems about how to collect this data to begin with, so that we could do better research.
Right, and when we're using, for example, in the other studies I presented, that race ethnicity information was coming from the vital statistics record. And, we've also tried to get clarification as much as possible about how that data is collected. Is it someone in the hospital who's asking the question, or are individuals filling out those forms independently? I think there are questions there as well as to how that information is being recorded. With regard to family size, I did want to mention that, in some of our research, we do see families with larger children having higher risks for Child Protective Services involvement, which I guess just probably makes sense on a very fundamental level. Probably the more children you have, the more likely you may be to run into different kinds of difficulties given children, given family circumstances. So, we do see in some studies a relationship there, but not always in other studies. An interesting finding from the third article I presented, which was the survey of caregivers in 50 California cities involved children's age. So in that study, we actually found older children to be at higher risk for the 3 indicators that we were looking at with regard to access to food, medical care, and safe supervision. And I think the supervision piece makes sense. The older children are, the more likely they're going to be more independent, and perhaps in settings where parents don't always feel the situation is safe. But I think the other indicators where we're seeing older children at greater risk may actually reflect, in some ways, the effectiveness of some of our early intervention programs, where we know in California there's a really high uptake of the WIC program, which provides nutrition and various resources for families with very young children, you know, those resources end at a particular age, you know, when children begin attending school. So not completely related to the question about number of children per se, but also something interesting I wanted to share.
Great, thank you. There are a few additional questions that came in, but we're just mindful of time, and so we're going to stop there. I'd like to let people know that we will send out the complete set of PowerPoint slides from each of the presentations. So we'll do that via email to everyone who registered for the webinar. Some people ask just how many people are participating, and so we wanted to share there are about 160 people that have participated today, and so we'd really like to thank the presenters, each of you taking the time and sharing both your work and experience, and then for everyone who actually joined the webinar today for your interest and involvement in this important conversation about the experiences of Latino children and families. And so this is not the only time we'll have this conversation, so we look forward to revisiting this. If you have not already done so, please mark your calendars for the next Alliance webinar, which will take place on Thursday, July 31st, also at 3 p.m. Eastern Time, 12 noon Pacific Time. That discussion will actually build on today's conversation in many respects and focus on the specific and unique experiences of immigrant families with this nation's child welfare system. For that upcoming webinar, we're excited about the opportunity to partner with our friends and colleagues at the Migration and Child Welfare National Network, and so we really appreciate Alan Detloff's kind of ongoing support and participation as a partner with the Alliance. So we look forward to working with you all leading up to the next webinar on July 31st. For those who have not seen it or seen information, please look for an additional announcement and invitation via email very soon. I also want to thank our team here at CSSP, especially Jonathan Lights, who's really leading a lot of the coordination for this year's webinar series. And then, of course, we extend our ongoing thanks to the Annie E. Casey Foundation for their continuing support of CSSP and the Alliance for Racial Equity and Child Welfare. The last thing I'll say is if you have not signed up to receive our emails directly, you can do so at www.cssp.org, and then you can find the Alliance for Racial Equity and Child Welfare page under the System Reform tab. And so if you have not signed up, we encourage you to do so you can receive the emails and announcements directly. So thank you again, everyone. We look forward to talking with you all again very soon. And so in the meantime, hopefully you'll be well and have a great day. Thank you all once again.
Thank you.